Because we're going to talk dentistry now on the programme. Are you struggling to see a dentist, or are you maybe going to the dentist as an NHS patient and saying, no can do, but if you want to get it done privately, then sit right there and open wide. A health watchdog says the pandemic has pushed dentistry to crisis point, depriving many patients of care. Health Watch England says some NHS patients have been asked to pay for private dental treatment, while others have been told they face waits of between several months and 2 years. Its chairman, Sir Robert Francis, says many patients have been left without proper care.
We've had a considerable increase in the number of people telling us they've been having great difficulty in accessing treatment, and in particular accessing treatment which, by all normal standards, would be considered emergencies. People who are trying to get treatment for dental pain, and this has not been considered to be an emergency. And in one particular case, a patient was suffering so much, he decided to extract his own teeth.
Ouch. The Department of Health says it's working to increase access to NHS services as quickly as possible. New targets and financial penalties across England this year started to make a difference, with some dentists now inviting patients for checkups. Mind you, in this pandemic, would you want to be going to the dentist unless it was an absolute emergency? Many dentists have questioned the wisdom of doing more face-to-face appointments during the current lockdown. Let's talk to Dr. Ben Atkins, President of the Oral Health Foundation, about this. Welcome to the Bernsey Show on BBC Radio Homicide. Morning to you. Thank you for this. From your perspective, how do you see this situation? Let me see if I can find you. Hello, Ben, are you there? Hold on, we just got, I've not got, no, let's see if we can find Ben. Ben, are you there?
Good morning, Bertie. How are you?
Yeah, I'm fine, thank you. Obviously problems with the faders. I'll blame it on the snow. Everything else will get blamed on the snow today.
Absolutely.
Where are you at on this from your position in terms of, have we got a crisis in dentistry? Or is it just was this an ongoing thing and it's been exacerbated by the pandemic?
I think you've hit it on the head there. I think it's an ongoing issue within dentistry, and it's the pandemic, like everything else, has exasperated the issues and the cracks we've got. So dentistry is a very complex issue within the country. We've got some amazing work that goes on in dentistry, and dentists just want to help. That's what we're there for. But the cracks are there, and I think the NHS does an amazing job at what we do, but we are struggling. But the COVID has not helped us all, has it?
No, exactly. Have we got a shortage of dentists anyway in this country? And NHS dentists?
I think it's about working with your local commissioners to finding out where your dentists are. I've been an NHS dentist for 20 odd years, and we've always taken back NHS patients on at my practices. So I understand the full implications of the system. It's a really pressurised job. Now, dentists throughout the country, there's different accessibility, and you've got to work with your primary care trust to find out where your local dentists are. And the key message to your patients is always try and get there early. Make sure you're getting to see a dentist not when there's a toothache happening, not when there's a problem. So once you've got yourself a dentist, it's actually a good thing to visit your dentist regularly, as they recommend. So Brexit, we're going to see. We're going to see what happens and how that's going to impact the amount of dentists within the country, because we have a lot of non-British dentists working in the UK, and we still don't know how that's going to affect the job market. So that will affect. We do need more NHS dentists throughout the country, but we always do. So it's working with your local dentist to get in early before you have a toothache. So it's managing access and finding out dentists early before you have a toothache in the evenings. All right.
So Brexit could make it worse, but presumably these are high-value individuals, dentists, and if they want to come, they'll get in no problem.
I can't comment on the government's policy on that, but you would think there would be a list like Australia where a lot of our young dentists go out to Australia to work. So the precedence has been set by it's easier to get into the country if you necessarily need access to dentists, but we haven't got there yet. So there's going to be a bump, and COVID has, as I say, possibly made things worse. There's a contract with what's called a units of dental activity contract, which has got many flaws in, and we are calling for a change in contract. But dental practices are there. We are open, but it's really important to make sure that you contact your dentist early before you're having an issue and start talking to practice. When are they going to be doing checkups? I think there's issues with negotiations with activity and contracts at the moment, but that I'm sure that will be sorted out. But the dental practices are really working very hard at the moment to see their patients.
Okay, she who cracks the whip, one of my producers has said, and she's just had a tooth out, so she did actually get there in the end.
There.
All right, but she had to pay for it because she couldn't get into an NHS dentist. You're saying make appointments, but the appointments aren't there.
I can't possibly comment on your producer's toothache, but I ran the out of hours service for Merseyside, Cheshire and Greater Manchester for a number of years. It's important to find, using 111 to access access to dental services through those. Now, is that happening, Ben? Is that happening at the moment in the pandemic? Because this report is saying it's not happening. It's a real struggle. People are being told if you pay for it, you're in. And I think that's the problem. It's finding out what dentists are actually doing. It's the clarity of your local dentist. So whose responsibility is that then? Whose responsibility is making sure that there are enough dentists? And that is down to the government to make sure that there is enough dentists to access dentistry, and your local health commissioner. And I've worked with many practices over the years to do that, but we're in a time of flux, and getting this contract sorted out it seems to be a real sticking point for dentists to access their patients to access their dentist. Right. Okay. And is it happening? Are you aware of people who would normally get NHS treatment having to pay for it? Personally, I'm not aware of that, but it's understanding what is urgent to do now and what can be delayed till later on. Personally, I've actually had to have a filling myself, and I managed to work with my local dentist to get that sort of thing sorted out. But you are seeing quite a lot of stories with Health Watch, within the press, of patients not being able to access NHS dentistry, and that needs to be sorted out, and signposting needs to be a lot clearer on how to do that. Okay, so what's the short-term solution? The long-term solution is we need more dentists. I think we all accept that. Short-term solution, is there a better way of doing it? I think the long-term solution is actually a new contract that makes dentists want to work within the NHS setting and are comfortable for our patients to understand what they're entitled to and how to work. With short-term, it's making sure we have these emergency slots so patients are out of pain just until the COVID situation has eased. Over the next 2 or 3 months, that is going to ease because the vaccination is increasing. All the dental teams are vaccinated, so that access should improve. Okay, but if you're a dentist, the money's in the private work, and unless you're socially and community motivated, you're more inclined to take the. Maybe I'm maligning dentists here, Ben. Sort me out. I'm not trying to. I'm just looking at it from a financial point of view. Is there any financial reward for taking the NHS payment when you can do the private work? Well, I think that's the difference. It's the need, because I've been an NHS dentist for a long time, and a lot of dentists are NHS dentists, and they've been that for a long time. So NHS dentists, the pay is comparable, but it's the understanding the system when you've got to take the pressure off to understanding how you work with the actual contracts with the NHS. So the actual issue we've got, realistically, is the contract we've got at the moment within dentistry is not fit for purpose. And that's what everybody is talking about. And that's why the government is actually prototyping and reviewing new NHS contracts coming in. So it's really critical that we get a simple contract that works for patients and the NHS alike, and it makes sure that the NHS gets value for money, because we're going to be in a time of financial challenges, especially at the coming month, 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 especially because I've been an NHS dentist for a long time, and a lot of dentists are NHS dentists, and they've been that for a long time. So NHS dentists, the pay is comparable, but it's the understanding the system when you've got to take the pressure off to understanding how you work with the actual contracts with the NHS. So the actual issue we've got realistically is the contract we've got at the moment within dentistry is not fit for purpose, and that's what everybody is talking about, and that's why the government is actually prototyping and reviewing new NHS contracts coming in. So it's really critical that we get a simple contract that works for patients and the NHS alike, and it makes sure that the NHS gets value for money, because we're going to be in a time of financial challenges, especially at the coming months. We've got to make sure that we get a lot more prevention into dentistry, because dental disease is fully preventable. There's no reason to get decay in your teeth if you brush your teeth twice a day with a fluoride toothpaste, you visit your dentist as regularly as we recommend, and you reduce the amount of sugar in your diet. It's really critical. So we could stop dental decay, and that would save the country a fortune.
Okay. But in the meantime, you say all dentists now and their staff have been vaccinated, so there should be more appointments coming online.
Yeah, absolutely. But dentists
you're open wide, I think, Ben, I think is the phrase.
Absolutely.
Not just open, you're open wide.
Lockdown. We are there. Sit back, put your head back. We are open, ready to help.
Okay. I even got a toothy grin there from She Who Cracks the Whip for that one.
That's impressive.
There you go. It is. Yeah. Nice to talk to you, Ben. Appreciate that.
Thank you. Keep smiling.
Thank you
very
go.
much.
Try my best. Dr. Ben Atkins, President of the Oral Health Foundation. What do you think today?